Where are all the time complications and resource utilization coming from, right? It's not coming from the 50-year-old who has uncomplicated pneumonia. And it's not coming from the 60-year-old who has a heart attack and goes and gets a stent, okay? It's not coming from the 30-year-old who has, a uterine procedure in the operating room for whom, some simple methods might work, okay? 80 to 90% of the time complications and resource utilization are coming from the demographics, the high risk, and the complexity. This is what's driving the bus. So in the old days, right, with those sort of younger patients, they didn't necessarily have multi-system problems coming in. Maybe one of their systems wasn't working well, but it was severe enough to treat and bring them into the ICU, okay? The source of their hemodynamic instability, hypotension, or in some cases shock, right? The source of that problem was more easily understood. Let's just take shock, instability. What you'll see in the textbook, okay, was just a few reasons that would happen. Hypovolemia, cardiogenic, distributive, the last one was obstructive, which we won't tend to deal with, okay? So just take the first three, okay? So if you speak with some of our intensivists or surgeons, this is what they were taught, and this is what will still show up in the textbook, right? This is the reason that the Swan-Ganz catheter was introduced into the environment. I'd look at the Swan or pressure flow or measure things with the patient, and all we had to decide was, is this a hypovolemic problem? Is this a cardiogenic problem? The guy's heart doesn't work right, okay? Or is this a distributive problem, like the patient has sepsis and their blood vessels are all dilated and they really need to put a lot more fluid into the system, right? So we'd use our simple tools, we'd get that simple answer, and we would proceed with simple therapies. What happens when you become older, sicker, with multiple comorbidities and complex procedures, with all sorts of different things going on, that's a multi-system problem, okay? And when you have a multi-system problem, your source of shock or instability is now really a mixed picture. So there is some volume issue that you have to deal with. There's some cardiac function issue, which sort of the heart muscle or myocardial function, and there's some distributive issue, and these things will occur simultaneously.
Need to reduce recovery time, complications, and resources in your ICU? Discover the Imicor 3-step method to hemodynamic stability, and stay tuned for more Whiteboards with Roth. Imicor, the hemodynamic ultrasound company.